Welcome to Understanding and Implementing Best Practice in Oral Care. So just to be very clear on what this presentation will cover, I'm going to be discussing the quality standard on oral health of adults in care homes, which was published in June 2017 and has now been implemented. This standard is what an inspectorate can draw upon. I will highlight why mouth care has been put on the CQC list and the impact poor oral health can have on the body. I would just like to mention that the information I'm going to go through is very much an overview and by no means detailed information of the training that we give carers. Now, Knowledge Oral Health Care was set up for a number of reasons, not only to educate the staff and promote oral health care for residents in care homes, but also to support the care staff in mouth care. People are keeping their teeth for a lot longer. Now, let's look at the demographics and see how things are changing. In 1968, 36% of the population, so roughly a third of the population aged 65 and above, were edentulous, in other words, had no teeth, compared to today, where it's believed that less than 6% of the population aged 65 and over have no teeth. So not only are people coming into care homes with more of their own teeth, but this will increase as time goes on. And the reason for this is that people are having more advanced dentistry. So people are having less extractions and having more complex restorative dentistry, such as crowns, bridges and implants. And I wouldn't expect someone to know if a resident has an implant, but the number of elderly residents that we see have implants, and it's going to increase as time goes on. Staff members need to know the importance of removing plaque, what it is and why it needs to be removed. So plaque is not removed regularly, it causes the gums to become inflamed, and you'll know this because the gums will bleed when brushed. But it's important to know that this is totally reversible and that in health, gums do not bleed. Plaque is essentially bacteria and it starts to form just literally hours after brushing our teeth. If it's not removed regularly, physically with a toothbrush, it will mature and cause problems to the teeth, gums and overall health. Now if you look at the picture on the right, you'll see that the gums are very red and inflamed, and this has been caused by plaque irritating the gums. The advice to someone with bleeding gums, whether they're being assisted with brushing or not, is that if they persevere with brushing, the bleeding will stop after about 2 to 3 days. Now the advice is to brush the gum margins, and this is where the gum meets the tooth, and not just brush the teeth. Now the other thing is that plaque will stick to any hard surface, which means that not only will it adhere to the teeth, but it sticks to the dentures too, so these need to be removed and cleaned. Now something to consider is that if the gums are inflamed, they will possibly feel tender when brushed, which may cause a person to resist when having their teeth brushed. So I would consider using a soft bristled brush for those people that resist. This slide demonstrates the surface area of inflammation in someone's mouth when placed on a leg. So taking the mouth out of the body and physically showing how it would look on a leg, for example. Now obviously the size of the ulcer would depend on how much inflammation was in the mouth, but you certainly wouldn't ignore this. Unfortunately with the mouth it's hidden and quite often not checked. We see a lot of decayed, broken teeth in care homes, and I should add that this is one of the reasons why mouth care needs to be prioritised. And it's not uncommon to see the elderly with one or some broken teeth. This is where the teeth have become so decayed they've broken off. If a carer saw this mouth, they would think that this person doesn't have teeth and not brush them quite often. But remember that plaque will stick to any hard surface, so these stumps, these little bits of teeth need to be brushed. Now the two components required for decay to occur is the presence of plaque and sugar. If plaque is left on the teeth, every time food is consumed that contains sugar, it turns the plaque to acid, and gradually over time it softens and erodes the enamel to cause a hole in the tooth. Poor oral health has been linked to a list of health conditions. It's well known to impact on the body. And how can this be, you ask? Well, the exact science is unknown, but data has shown that there's a definite link between poor oral health and an impact on someone's overall health. Now, experts believe that oral bacteria escape into the bloodstream through the gums to injure parts of the body, and here you'll see a list of conditions that poor oral health has been linked to. It's firmly established that there's a link exists between periodontal disease and heart disease. The data is pretty strong. Bacteria from the mouth has been found in the vessels and heart valves of people with heart disease. And in actual fact, people with poor oral health are twice as likely to get heart disease compared to those that have good oral health. Oral bacteria is thought to damage blood vessels or cause blood clots by releasing toxins that resemble protein found in artery walls. Now, this is very interesting. Recent studies have shown links between gum disease and dementia. Bacteria from the oral cavity, so Porphyromanus gingivitis, has been shown in the brain tissue of those people with dementia compared to those without. So it's thought that bacteria cause inflammation and kill off brain cells. Something else that poor oral health has been linked to is aspiration pneumonia, and this is when plant bacteria and debris from the mouth get inhaled into the lungs to cause an infection, and it's a life-threatening condition. And so many times I've been told by carers and care managers not to attend to people and brush residents' teeth that are poorly. And if I can just stress that it's even more important if a person isn't well to brush their teeth, because it's all about lowering the bacteria levels in the oral cavity and also the sense of well-being a clean mouth gives. So let's take a look at the NICE guidelines. The Public Health England's report on oral health of older people in England and Wales prompted the new guidance by the health watchdog NICE, calling on all care homes to prioritise oral health and access to dental treatments, because it's just as important as other aspects of general health. Now, to make things really clear on what the recommendations are, NICE produced a quick guide resource aimed at care managers, which I'll go through, but I think it's important to understand why these recommendations have been introduced. There is a wealth of research to demonstrate that oral care and care homes need to be prioritised, and this can be evidenced and viewed on the NICE website. Now, the committee discussed the fact that oral health care may be a low priority in care homes, and it noticed that when someone is unable to maintain their own oral health, they should be given help to do so. Here, NICE warns care homes not to neglect dental health. It states that more than half of older people living in Britain's care homes have tooth decay, far more than the number of those that don't live in care homes. The Registered Nurse Association responded to NICE published guidelines, saying that dental services need to be more readily available and that staff need more expert help and advice on oral care. Now, it's the reason why Knowledge Oral Health Care have an advice line. Let's take a look at the guidelines and have a look at what CQC expect from you. I've highlighted here in light blue the quality standard and those recommendations or best practice relevant for care homes, and I'll go through the oral care policy and quality standard in more detail. By being effective and responsive with evidence about how you support residents to maintain good oral health will help you demonstrate that your service is both effective and responsive. So let's take a look at care home policies on oral health and providing residents with support to access dental services. It would be sensible to have an oral care policy in place for your care home and something that is best practice. So the sort of things you should consider putting in an oral care policy are things like, do you have a local dentist that will provide out of hours treatment cover for your care home? Find about your local community dental service and special care team so that you know what to do when you need to refer someone or if you need to refer someone. Include your oral care training provision for care staff, and especially for those staff that need special care training for residents with complex needs. I would include implementing oral health assessments and referring to a dentist if required. I would write what your policy is for those residents that resist oral care, and just remember that oral care is basic personal care and should not be readily dismissed because the resident has said no to brushing. That person that resists should be coaxed into brushing, and if this doesn't work, to be approached again at a different time. There are coping strategies for residents that resist, which we discuss in more detail in our training. You could also state if you stock and provide mouth care products. Now, we have designed an oral care policy which you can, we're happy for you to download and edit to suit your care home. It's on our website. If you look at the page, what CQC expects, and you'll see it there. I'll now go through the quality standard that were published in June 2017, and this is what's mandatory and can be drawn upon on an inspection. So let's have a look at what these are, what these mean for you. So we have oral health assessments, recording mouth care in care plans, and supporting daily mouth care. So starting off with the oral health assessments. When someone is admitted into your care home, regardless of how long their stay is with you, you need to carry out an oral health assessment on that person. Now, I'd just like to mention at this point that it's really helpful to use a torture pen, as the mouth is a really dark place, so it makes visibility much easier. It's helpful to know that people are likely to present with existing mouth problems when admitted from living on their own. Having looked in many residents' mouths, I can personally vouch that we see a lot of residents that have broken teeth, and in a majority of cases it's simply because the teeth have been so decayed that they've broken. The other thing we see are broken dentures and ill-fitting dentures and inflammation underneath dentures, which is like a redness. It's called denture stomatitis. Now, the quality standard states ensure that care staff are trained to understand mouth care needs, to carry out the assessment, and that staff should be aware of signs of dental ill health. It would be an idea to consider nominating an oral champion, and it's advisable for caregivers to have oral care training, and yes, there is a lack of training resources at the moment, which we are trying to address. NICE do have an oral health assessment tool on their website which you can download and use. We have a simple oral health assessment form which you can also duplicate and use. Now, the oral health assessment, you need to find out basic information from the resident and or next of kin. But can I just highlight that it's not just a matter of asking the resident or next of kin for information, it also involves physically looking in the mouth. But with regards to asking questions, you need to ask things such as whether they wear a denture. If so, do they leave their denture out at night? Is the denture marked with their name on? Do they have any oral concerns? Are they in pain with their mouth at all? Are they registered with a dentist? What is their oral care regime at home and their brushing aids used? Do they use an electric toothbrush? What products do they like to use? And look to see if there are any obvious observations such as broken teeth or sores. Now, the most important information for me to find out is if a person needs to be prompted or assisted with brushing. What I have personally found from experience is that those people that are able to brush their own teeth themselves often forget to brush and need to be reminded and prompted. And then there are those that have reduced manual dexterity due to age and need guidance. And there are those that need to be fully assisted because of dementia and other reasons. Recording mouth care needs and care plans. Ensure that adults living in care homes have their mouth care needs recorded in their personal care plan. This simply means to discover what the resident requires and requests, and you'll find that it's the same or similar oral care regime for every resident. The physical removal of plaque with a toothbrush, with the exception of some palliative end-of-life oral care where other aids may be necessary. And whilst I've mentioned palliative care, please be cautious when using sponge swabs. Now, these are banned in Wales and are on a medical device alert in England. My advice would be to find an alternative to the sponge swabs. And it would be worth viewing our web page on mouth sponge swabs and no pineapple juice. For more information, have a look at the information we have on our website. In the care plan, it should be noted if a resident refuses brushing, and please return at a later time of day to approach the resident, and this may be in the afternoon. Supporting daily mouth care. This is to ensure that residents are supported with daily mouth care. It's the twice daily cleaning of teeth and/or dentures, and it means that staff either need to oversee the brushing and/or assist. If support is needed, ensure that care staff are trained to offer this support. Care staff knowledge and skills. This is basically training in oral care for the staff, and the guidelines state, ensure care staff who provide daily personal care understand the importance of oral health and the potential effect it can have on their general health, that they know how to deliver oral care, training for staff with dementia or communication difficulties. As stated earlier, staff need training and support with oral care and palliative end-of-life mouth care to build knowledge and confidence. Knowledge oral health care deliver mouth care training to care staff in care homes delivered by dental care professionals via in-house training, so the 2-hour in-house training sessions. We also have train-the-trainer sessions, and we're also able to deliver it via live webinar, which is interactive. And we've recently set up a monthly subscription so that care homes can have ongoing mouth care training for their staff.